knee pain with jumping? You might have jumper's knee or patellar tendonitis, but it doesn't always require jumping activities to have pain. Sometimes people have patellar tendonitis with just kind of prolonged sitting. Patellar tendonitis describes irritation of the tendon between the bottom of the kneecap and the top of the shin, just this tendon right in through here. And that can become sore, of course, with jumping, but also sitting for long periods of time, especially with the feet tucked underneath. So the patellar tendon comes up to the kneecap and it's continuous with what's called the quadriceps tendon here and then into the quadriceps muscle. Here's my trifecta of self-care: stretch, strengthen, scrape that will get you back on the way. Here's an easy stretch for the thigh or quadriceps muscle. So just grab a chair or counter if you need it, and you're going to grab the heel and pull it toward the bum. Try and squeeze the bum cheeks together to kind of open up through the hip flexor, and just pull the heel as close as is comfortable. If that doesn't feel good, you can grab a towel, wrap it around the foot, and pull that up toward the bum. And if that is still not in the cards, another option is to just put the foot back on the chair and bend down to open up through the thigh. The massage or scraping part of self-care involves the quadriceps muscle and the patellar tendon. So for the tendon itself, I like to use the handle of a butter knife. You could also use the handle of a wooden spoon, really anything. And you just take that and you just kind of scrape in between that bump at the top of the shin and the bottom of the kneecap, and up and down. Usually this isn't super tender, so you can kind of get in there a little bit, but just as much as is comfortable. For the thigh muscle, I love a rolling pin, not just for pies. So you want to be working the entire quadriceps muscle all the way from the inside, the top, and the outside. If you have a fancy massage stick, that works as well. Of course, you're going to be going from the kneecap all the way up to the hip bone. This feels really good, so you can get in there as much as you like. As for strengthening, we want to be thinking about all the muscles around the knee. So of course the thighs, the hamstrings, and the glutes, in addition to the calves. So any of the, toe raises are good. Squats are great. Single leg squats are excellent. Here's another one we haven't talked about before. This is very safe, especially if things are a little bit irritable. So you're going to use your foam roller, and if you don't have one, a rolled up towel or a pillow underneath the knees is great. Now this is called terminal extension. And all you're going to do is put that underneath the knee. It's as if you're going to lift the foot up off the ground to straighten the knee, but you're not going to. You're going to keep the heel down, and you're going to push down into the towel or pillow. So when you push down, you're going to feel engagement through the thigh, the hamstring, and the bum, and you can hold for a few seconds and let that up. This is a really effective, very safe way to strengthen up the muscles around the knee, and it's usually very well tolerated. So give that a try. Good luck dealing with your knee. You'll be back on the court as soon as you know it.